a lot of clients are actually interested in psychedelic therapy and treatment, and we work our way towards that. So even if they do come to me initially interested in psychedelic treatment, some people aren't ready. And we gauge it like with each other. Again, collaborative approach.
Mindbend. Non-ordinary and extraordinary states of consciousness for Mindbend Creative.
Dr. Bianca Hur, thank you for joining me on Mindbend.
Thank you for having me.
You got it. We've been talking about this for a while, and
Yes.
Your interview with me today marks sort of a triumphant return to Mindbend. Been away for a little bit, and now bringing it back with a vengeance. So happy to have you helping usher in a new era.
Oh, I'm so honored to be here, and especially to usher in that new era and jumpstart.
And you asked me to give you some questions before the interview today, and normally I don't do it. It could be out of laziness. It could be out of a sense of adventure and just looking to see what kind of worm cans we get to open. But usually my goal with every guest is to allow you the opportunity to speak about what matters most to you. And the show is always an entry point. Psychedelics is kind of like a starting point for discussion, but consciousness overall and the human experience as it relates to our mental world, our emotional world, our spiritual world, and it seems to all kind of come together under the field of psychology. Is that accurate?
I guess so.
Well, what does a psychologist do, Bianca? In this day and age, like what does this psychologist do?
This psychologist over here does a lot of things. A psychologist, I mean, there's so many different angles, right? So what is psychology? Psychology stems from philosophy, and it's very abstract. And there's so many different ways to approach the psyche, the conscious mind, aware, the thoughts that we're aware of, and then the subconscious mind. And I'm really interested in how the subconscious mind, which is 90% of the iceberg, or more actually, affects our conscious thoughts and our behaviors. So I'm really interested in the subconscious mind, and using different states of consciousness to access that subconscious part of the mind.
Is the subconscious mind what we're always contending with during psychedelic experiences? Is it predominantly what we experience? Do we experience the subconscious in psychedelic experiences? Can you say that? Can you make a blanket statement? Does it work to say that? Or
Oh, I'm afraid to make a blanket statement about anything. And that's psychology too. It's always, it depends. But for this context, I feel like, mostly, yes. The psychedelic state of mind is very similar to the dream state. So the way that the mind is working, the loss of time and space, and the breakdown of the top-down approach. So that part of it is very similar to the dream state, where kind of everything opens up and things don't necessarily make sense. Sometimes we can't even verbalize certain things that we experience in our dream or our psychedelic journeys. And also
when looking back, we can't put words to it. It's ineffable.
Right, it's ineffable. And another thing that makes it similar to the dream state is that when we don't integrate it, we can lose it. We can lose the content. Yeah.
We can lose the memory.
We can lose the memory, the learning. Exactly.
Do you consider yourself to be a psychedelic psychologist?
I do. I definitely do. It's something that I work with. It's not the only thing that I do, but I would definitely say that's one part of my work.
When people come to see you, where are they coming from typically? Like what in your experience and in your business, like how do people find you, and is there something that sort of commonly unites them, or is there something you consider to be like a speciality that you're addressing with your clientele?
Not really.
Yeah.
They're coming from all over. They find me online. They find me through referrals. They find me through different psychedelic associations that I'm associated with or that I've worked with, or a news article, or they come to my workshop and they, learn about the work that I do. So they come from all over, all age groups, all different types of occupations, all levels of previous psychedelic exposure. Some people are coming to me for trauma. Some people are coming to me for anxiety, some for depression. But mostly people are coming to me when they have, when they've tried all other things and they feel like they're stuck and they want to get unstuck. That's the main,
and not just coming to you for psychedelic discourse or learning, but just as a psychologist. They're finding you later on, or sometimes you the first professional they speak to as that kind of therapy. Just seeing a psychologist the first time. You have people that come to you.
Yes. Yeah, I do. I have people come to me who are just starting this journey and come to me because normal regular talk therapy doesn't resonate with them, and they like that I'm associated with different types of modalities. And then there's people who come to me after they've been in therapy for 15 years and been in talk therapy and have beat the donkey, or what's the term?
Beat a dead horse?
Beat a dead horse.
Or a donkey, I guess,
or
that's your preference.
Okay, I don't know. But after they've done all the talk therapy and they're like, okay, I know, I'm aware of my patterns, I'm aware of my issues, but I can't seem to get out of it.
Yeah.
Yeah.
You have a list of your tools that you utilize on the website. So run down that list for us. I know hypnotherapy is one of them, and just kind of lay out the menu for us.
Okay. Mind-body modalities, somatic therapy, hypnotherapy. I do ecstatic dance workshops. It's a different modality of ecstatic dance that implements Kundalini concepts. So it's called heal through dance, but it's a form of ecstatic dance.
Okay.
Psychedelic therapy. What else? What else do I do?
You also do the cognitive therapy too?
I do. I do talk therapy as well.
Yeah.
Regular talk therapy.
Yeah.
Yeah.
So maybe somebody has been exhausted by that in the past, but maybe they're able to turn a new leaf with you because of your superpower, which is what? What's your superpower in this space?
My superpower in the space? I feel like my superpower is my ability to work with someone from where they're at and with their interests and kind of tap into what would work for them. It's not always psychedelic therapy. Sometimes it is cognitive therapy. Sometimes it is somatic therapy. So I just pull from my tools based on the individual, their interests, their what speaks to them.
So your superpower would be being able to discern what might be the best fit for an individual. You feel like you're particularly adept at that?
Yes. Yeah. And exploring together. I think, collaboration is really a big component.
What allows you to be a good collaborator in a psychotherapeutic context?
That's a really good question. Yeah.
I'm here to ask you decent questions.
Okay.
If I get to really good, we're in good shape.
I'm saying that's a good question because I'm searching for an answer right now. What makes me a good collaborator?
I don't often have the opportunity to just visit with a psychologist. I think a lot of people don't either. So if you're out there considering is psychotherapy right for me? Should I go to a psychologist? Have I been referred to a psychologist? When you show up for a professional and they're going to give you care, you don't really get to be so how do you like being a psychologist? What does it feel like to be a psychologist?
Right.
When we form relationships with people, friendships and family, we take into account lots of different aspects of who we are so that we understand each other and we can more easily communicate, I think, right? But it's always like a leap of faith to enter into a pretty intimate container of information without really having any personal knowledge of one another, you know. It just doesn't get to happen.
Yeah.
So, you know, today, you know, I'm asking some of the questions that like maybe somebody would be curious about knowing, like, you know, you are in a pretty tremendous position to be a person that delves into the intimate details of someone's lives, and sometimes in the most like immediate periods of need, you know. So like it's fascinating to me, like, how are you able to do it? You know, what is it in you? Like, is it the work you've done? Have you had revelations? Like, did you always know that you were going to be in this space? Like, give us a little bit of background on what got you to the point of being a confident and practicing psychologist.
My own life experiences, my own self-experimentation with my own psyche, my own exploration of consciousness, and my exploration of reality and perception. It was a lot of my own self-work that led me to even explore being a psychologist. So yeah, I think it was my own journey that gives me empathy. Yeah, I didn't know that I was going to be a psychologist. I never dreamed about it when I was younger. I was actually in a completely different industry. And then in my mid-20s, I had some revelations where I realized I wasn't happy where I was. On the external, it looked like I was extremely successful. It looked like I had it all together. But I was feeling empty inside. I was unsatisfied with my life. And I realized that I had been living up to other people's expectations and just not really living an intentional life. And that's when I started to question everything. Not to get too much into my story, but
yeah, you don't have to.
But you know, some things happened, made some big mistakes that had some pretty big consequences, and I felt lost. I really felt lost, and that's when I started getting into, okay, how have I lived my life up to this point where I'm feeling so lost, and I feel so out of touch with who I am. I don't know who I am anymore, and it's like I seemed so confident like all my life. And then I started getting into meditation, Buddhism, spirituality, yoga, and then I started reading books about consciousness and then the subconscious mind. And then somehow that led me to learn about psychedelics, and I did my own psychedelic healing. I didn't even know psychedelic therapy was a thing back then, but I was experimenting on myself, having intentional journeys, preparing myself physically, spiritually, emotionally before a journey, and doing the integration on myself afterwards. And then I started being more open to the community of it. And then I did reach some level of, I guess at that time, like spiritual awakening, whatever that means, right? Because that's like a continuous journey. But that was my first opening to spirituality and truly feeling what that feels like and what that means.
You're saying that the psychedelic experiences specifically helped open a new aspect of your own spiritual exploration and the consideration of spirituality.
Yeah. That really was a big tool in that process because, you know, I was also meditating, you know, doing yoga, delving into philosophy, you know, Buddhism, yoga, like all these ancient philosophies. I was doing that part too, but the psychedelics was a big tool to really push me forward. And then after the psychedelics, I was interested in other states of other ways to get to that altered state of consciousness without even using psychedelics.
Yeah. And this show is non-ordinary and extraordinary states of consciousness. So we've talked to meditation, breathwork instructors, hypnotherapists, sex therapists, like non-ordinary consciousness. When I think of that term, what do you think of when you think of non-ordinary consciousness?
Non-ordinary consciousness is a part of our everyday life. We think we're in an ordinary state of consciousness all day, but we're not. When we're driving, when we're doing things that we're used to doing, when we're waking up in the morning, when we're falling asleep at night, there's times in the day that we're in some sort of trance state. So it's actually much more a part of our lives than we realize.
Can you explain neurologically what's at work with our minds, if that's where our consciousness is, when we're in an ordinary state? An ordinary state is like facilitating a conversation right now. An ordinary state is like doing task work on the computer. Are those ordinary states? And what are they governed by, like neurologically?
Oh God, don't ask me.
But something is altered neurologically when we have a psychedelic experience, which allows for a different kind of consciousness.
Yeah, it does.
Yeah.
Yes, definitely. Right. Anybody who's ever had access to, psychedelic experiences will say that, it like changes your perception. You start to see things differently. I always say one of the things is that stays with me is when I did my first LSD trip, I did it in nature, and I saw the energy in the sky and in the trees, and I've never unseen them after that. So I just feel the sky and the trees, and I can feel the energy, and I feel like that was something that I wasn't quite aware of. It was always there, but I wasn't aware of it until my first LSD journey.
Which I guess on its own could have like redemptive or inspiring components for somebody who's dealing with something that they might feel like they need to seek professional mental health care for. If someone feels stuck, if someone feels lacking for joy for whatever reason, like whatever that diagnosis might be, I think that's part of the plan to utilize these sorts of modalities for moving beyond those stuck states, right?
Yes.
We're not outing you by having this conversation today, are we? Like, you can talk with your clientele about, do you often talk with your clientele about considering a psychedelic through a traditional recognized psychedelic like modality, however illegal it may be? Like, does this come up often in communicating with your client base?
It depends. It depends on the client.
Yeah.
And they know what I do. I'm open about it. It's on my website. When they come to see me, I always ask new clients, have you seen my website? Anything that stands out? What do you like about it? What are you interested about? Because there's so many different things that I do. So sometimes they want to learn about meditation. Sometimes they want to learn about breath work. Sometimes they're interested in hypnosis. And a lot of clients are actually interested in psychedelic therapy and treatment. And we work our way towards that. So even if they do come to me initially interested in psychedelic treatment, some people aren't ready. And we gauge it like with each other, again, collaborative approach. So, and sometimes it takes 6 months to get ready for a journey. Sometimes we use other modalities, and my client will say, actually, I don't need it. I feel like I reached all the goals that I've come here for. So then we don't even need it. I don't shove it down anyone's throat. Yeah, I let them come to me about it unless I see something in that person that I'm like, you know what? We've tried everything. Maybe we can try this if you're open to it. And then again, it's a whole preparation phase that starts as soon as we decide to go into psychedelic therapy.
Okay, if you're deciding to go into psychedelic therapy with a client who you feel is equipped to handle it and responsible and has a good orientation on what they're going into. Are you able to discuss the details of what like a protocol might entail with somebody who wants to go into that space? Can you get into the nitty-gritty of what that practice looks like?
Yeah, definitely. So the preparation, again, it's very personalized, but there's going to be a lot of intentionality behind it. What's the intention? What's the goal? Really understanding what they're working with, what they're going into the psychedelic with, understanding their mindset, understanding their history and their patterns. So that would look like what a typical therapy session would look.
In person or remote.
In person or remote, yeah. So that would just look like typical talk therapy, understanding like your belief system, how certain things have affected you. And really just the most important part going into it is intentionality. When there is an intention, that's what is one of the biggest things that takes it apart from recreational use.
Okay, and before I forget to address this, you somehow found a way to create that kind of intentional process around your early experimentation on your own, which it seems, like that seems like a fairly responsible thing to have done, to have the foresight to look at it and say, I'm going to do this, maybe LSD in this example, but I'm going to do it not just to do it and see what happens, but you kind of set about to do it in a very intentional way. So intentionality comes easy to you.
It does. Yeah. And psychedelics wasn't the motive. The motive was spiritual awakening.
Okay. So
I guess?
you
Or
sought out a psychedelic modality in order to help foster spiritual.
Right. Like the psychedelics happened after I was engaged in all these spiritual practices and had done a lot of work on myself. And then I read in a book, I read the Harvard Psychedelic Experiment, and then I read, I think it was like LSD psychotherapy or something. Like I read a couple books that led me to open my eyes, and I was like, LSD, what is that? I didn't even know what it was. I'd never had access to it. I knew what weed was, I knew what mushrooms were, but I didn't know what acid was, and I thought acid was like this intense, scary thing. But then I somehow it landed in my lap. I don't know. I just searched for it and I found it. But psychedelic experimentation happened as a byproduct of
after the initial intention.
Yeah.
So LSD then is the traditional psychedelic that you're using in the therapeutic setting?
No, actually,
Okay.
Not using LSD right now.
Okay.
Yeah, that was for my own initial experimentation.
Okay. So what are you using in your practice?
Psilocybin.
Okay.
Ketamine.
Okay.
Which is, totally legal.
That's a different protocol than a psilocybin experience. Similar.
Yeah.
You have to determine what you think is best for the client. They just have a general openness to a psychedelic medicine?
Yes.
Okay.
Yeah. And then they will usually, most of the time, come to me with an idea of what psychedelic they want to explore.
Okay. Oh, so they know that you're a safe person for them to talk to about this.
Yes.
Open-minded and knowledgeable. And they say, I had a friend that went to a ketamine clinic and had a regimen of 6 IV ketamine sessions, and they had a good response from it. I don't think I want to do that. I don't think I want to do any of these mail order ketamine protocols. I think I'd like to try that particular medicine in a more traditional psychotherapeutic context. That might be what someone could come to you with.
Yes.
Okay. And that's something that you have like experience and familiarity with administering then?
Yes.
Okay.
Yeah. I have training. I've been in an experiential training for ketamine assisted therapy.
Yeah.
I would never sit with someone or sit for someone or help guide someone, whatever it is, for something that I haven't tried myself. So everything that I'm using with anyone, I've experimented with myself in all different doses.
So let's use this opportunity then to drill down into the difference between a psychologist such as yourself administering psychedelic assisted therapy with two different medicines, ketamine and psilocybin. Let's talk about the differences and the similarities, if you would, please.
Okay. It's very similar because the modality is, right, preparation and then having the actual experience. Set and setting is important, and preparing for that mindset without coming into the session with. Knowing, kind of giving the client what to prepare for, and then integration. Integration is probably I don't even want to say the most important, because preparation is just as important, but integration is extremely important part of the process. So in that sense, that's the same. What's different is probably the experience, and the experience based on the dosage of what you're taking. So with ketamine, there's different ways to administer ketamine, right? Like you said, there's the IV drip. That one I don't work with. That's usually at a center, like a drip center, something like that. What I work with is the drops or the sublingual. So they'll melt it under their tongue. And then they'll go into a journey. And based on the dosage, the journey with ketamine will be shorter, just because it's in and out of your system quicker. So it's easier access in terms of time limited. It's in and out of your system. You know that you can, slot out 3 to 4 hours and you'll be fine to, go on your way home afterwards, even though you can't drive afterwards. For any, after any psychedelic session, you shouldn't be driving. You have to take, the most ideal is have someone come pick you up.
Yeah.
With psilocybin, you don't know how long that's going to be. So that can be 2 hours, that can be 3 hours, that can be 5 hours, 6 hours, or 7 hours, depending on the dosage and how each person
metabolizes.
Metabolizes it and how they interact with that drug. So,
but these are sessions that are happening in person with you at your office?
Yes.
Psilocybin and ketamine?
Yes.
Okay, cool.
Yeah.
And they decide and you set it up, and then it's, so continuing with the differences and similarities, what are you seeing as similarities for experience? Like, what's that experience like? Take us into the moment where someone's, they've taken the sublingual ketamine lozenge, or they've taken the capsule. Is that how the psilocybin is administered? Via a capsule?
Yeah, it could be capsule, tea, or gummy. Yeah.
Okay. So it's a couch in the office space?
I have a couch, and then I have a space where I do my workshops, which is a yoga space. So I have like yoga mats out and rollers, and some clients will love to just be out on the mats and roll around most of the time. But there's also the couch for some privacy, own room. You have the headphones on, you have the blindfolds on, and you're on your own journey. With ketamine, it's definitely more, not always, but there's a lot of like more time on the couch. Like, it's because it'll relax you, right? It's originally an anesthetic. So you will feel really relaxed at first, and then you kind of just like, oh, okay. And then like feel like loose, and then your body will kind of just be like very still on ketamine most of the time. And then you'll have that internal journeying. So most of the time I'll see like the internal journeying through ketamine, and then we talk afterwards.
So you're not directly interfacing with them while they're having their experience with ketamine specifically.
Sometimes I am.
Sometimes you are.
It depends on the person.
Okay.
Yeah. Sometimes they don't even want to do the whole music. They would just want the music outside. Like they don't want it in their headphones.
Mm-hmm.
And they want to tell me about everything that they're experiencing. And then I'll take notes. And then they want to talk to me the whole time. And I'll talk to them the whole time. So it depends on the person, really. With psilocybin, it is more active. It's not it's not gonna make you, well, sometimes it can make you super relaxed and you just want to chill and you just want to lay down and have your earphones on and, you know, just be in your own space and your own journey. But most of the time there's a big portion of the session that's pretty active where we'll be talking, we'll do yoga. There's also a park downstairs in my office space, so we'll go for a walk in the park, we'll sit under a tree, we'll connect with nature. They'll like choose a favorite tree and we'll kind of, you know, meditate with it. It's very flexible. Like each session looks so different. And it really doesn't matter, ketamine or psilocybin, you can have a very similar experience. It's just the physical component of it is the major difference, I think.
The physical component of it being
that ketamine is more of a I'm going to say the anesthetic,
Uh-huh.
so then your body becomes more relaxed.
Mm-hmm.
And with psilocybin, you might maybe want to be more active. Maybe you want to take a walk. Maybe you want to move your body. Maybe you want to do some yoga, stretch, dance, talk.
Mm-hmm. Looking at a favorite tree is maybe one of the cards in your deck that you have to draw and say, this is an exercise that would make sense right now. Or maybe the moment is right for a particular type of reflection on gratitude or something. Like you're charged with providing like cues and signposts along the way, in addition to rolling with and working intuitively with what they're presenting as what could be useful in the moment.
Yes.
Yeah.
Yeah.
It takes a lot of heart, right? Like you have to have like a lot of love for people and a lot of like heart and focus. You cannot be a distracted trip sitter or much less psychotherapist or psychologist.
No, you can't be on your phone. You like some people think like, oh yeah, you're just like, you give them some music and they put on some eye mask and then you're just like on your phone texting or like doing some other thing. No, even if they're in their own space and their own journey, you need to be attuned to this person and make sure that they know that they are held and they are safe. Obviously you're not like holding them unless they want to be held. Sometimes you might want to be held, but usually you don't need to hold them. It's just they know that you're there no matter, like, so that they can go deep. You know, it's safe for them to go deep and to go as far as they need to go. So you really do have to be attuned, right? So if someone's like in their space and then their movement changes or their breath pattern changes, I will check in with them, or I will get closer and keep my eye out to see what's going to happen next. So it really does take a lot of heart. And, you know, just like with any other therapeutic relationship, the most healing component of the therapeutic relationship is the relationship. It's that your client trusts you, that they feel safe with you, and that is the building block for any therapy. So you're right. Yeah, it does take a lot of heart. It does take a lot of energy.
Yeah, I was going to ask you, how many of these psychedelic therapeutic sessions do you think you could handle in 1 month? Just energetically on your own. Have you done multiple sessions in a day before?
No, I can't.
Yeah.
No. Yeah. Unless I'm doing a group session, then I will have people who are helping me with the, like, other professionals who are helping me in the group setting.
Yeah.
So we have like 2 or 3 people, 2 or 3 workshop participants to one person. So if anything happens, that we know we have enough people to take care of the space. But I would never do 2 in a day, just because I do put my all into it. It's very inspiring. I love it. It's one of the most favorite things that I do.
Yeah.
But it is a lot. So I try not to overload my schedule. The most that I will try to do is 2 in a week. And even so, I still try to keep it at 1 a week max.
Okay.
Yeah.
All right. Interesting.
Yeah. If even. Yeah. But one a week max. Yeah.
Do you think that is something that you've seen in peers in the space that is kind of a guideline that people kind of sort of work with, or is that just entirely your personal preference? It's
probably my personal preference. I would do more, honestly, but I do have a big caseload of individual clients currently. Yeah. So when I wasn't having that many individual clients, I would do 3 a week. You know, I could do, I don't want to say 4 a week. 4 a week might be too much, just because I really like to, I'm a very sensitive person, and I think the most important thing is my presence. And if I was doing more than 3 a week, I really don't think I could be as present and as valuable to helping someone go through that intense experience. Because it is an intense experience, and you never know what to expect. It can become overwhelming. And
let's talk about the overwhelming moments. Like, let's talk about when it gets to feel like it might be too much, or at least unpleasant for people in these experiences. Whether it's I can't imagine that it happens as much with the ketamine experiences as it might with the psilocybin. Is it safe to say that there's a higher likelihood of a more challenging experience with the psilocybin journey than with a ketamine journey, or do you find them to be equal in your experience?
I would agree. I think definitely more with the psilocybin. But I have seen it with ketamine too. Yeah. And it's really, again, it's the same process. You just help the client come back to the present moment, help regulate their nervous system.
Is that through breathing?
Yeah. You know, we do grounding before, and I'll give them a few easy, simple breathing methods to remember going into the session. And way before the session, we'll be working on breathing methods, because breathing methods are one of my favorite things to teach my clients. I teach probably every single client breathing techniques. And one of my clients said the other day, she's like, I don't want to breathe today. And then she talks about, and she's like, but it's been hard for me to breathe. I've been having trouble breathing. And I was like, all right, just exhale, don't inhale, exhale. And then we started breathing together, and she's like, oh my gosh, you're so good at tricking me into breathing. So I love tricking people into breathing, in a good way, of course. But breathing is like the most powerful method, but also
for overwhelming moments, for navigating challenging moments.
For navigating challenging moments, and then just being there and letting them talk through it. And sitting with them, listening to them, again, coming back to the safety component, letting them know that they're safe. You know, this moment's going to pass. Surrender, you know, let go, surrender. Give them the courage and the safety, the support to be able to face whatever is coming up. Because usually what's happening when they become scared or overwhelmed is that there's a component of control, where they're not like letting go of that control. Sometimes it is just overwhelming, because it can be overwhelming, like different things that are coming up. Like it can be a scary moment that had happened, or something that they're just not understanding, and it scares them because they can't understand it. Or if it's a really high dose, which I tend to stay away from, heroic doses,
Yeah, that's a good question, which we didn't address. Like, because ketamine is the only legal psychedelic modality that's administered, like, therapeutically right now in the U.S. in most places, right?
Yeah.
I mean, that's fair to say, correct?
Yes.
So how is it, there's more guidelines set up for that, or at least there's more literature on guidelines, right? So how does one seeking to administer psilocybin in a therapeutic setting, like, go about constructing, like, wise protocols?
Oh, there are tons of trainings, I would definitely, I've done trainings, recommend trainings, definitely trainings, reading books, having your own experience. There's nothing more valuable than experiential trainings. You don't know what your client is potentially going through unless you've gone through it. So if you're going to administer it, I say you have to be brave enough to have different types of experiences with different doses.
Have you navigated challenging experiences of your own in psychedelic?
Yes, of course.
Yeah. And you were equipped to handle them because you had done your homework ahead of time? Or were there things that you felt like, okay, this is new and I'm going to have to deal with it as skillfully as possible? Can you share a little bit about that in your own experience?
Yeah, I've had challenging experiences. I've had ego death. I've had several heroic doses where I've thought I was going to die.
Yeah.
And
meaning what? What does that mean exactly? Like, I took too much. I feel death coming on. I'm haunted by evil demons. I'm being attacked psychically by interdimensional. Like, what's the...
Not necessarily that. For me, it was... I had taken a high dose and I started to lose sense of my... And this had happened with a high dose of ketamine, as well as... I've had this on ketamine, LSD, and on psilocybin. I've had ego death experiences.
Okay. High dose for psilocybin would be, in this instance?
Honestly, I don't even know how much I took because we were just munching on them.
Wow, okay.
We were just munching on a bag of mushrooms.
Okay.
Yeah. So, I was like starting to lose sense of myself and becoming one with my surroundings, which was nature. I like to do nature. So I felt that I was becoming one with nature, and that everything is one. The reality of nature is really just an illusion. And as I was losing sense of my humanness, again, this is an ineffable experience. It's really hard to describe.
Thanks for trying.
Yeah. I'm sure there's better words for it online. We can find it. But I was losing sense of myself. And I thought, because I'm one with the universe, now I am going to disappear, because now I know that the nature of the universe is just all an illusion. And we're just all one. And that's it.
That's it.
I'm done.
Now that you figured it out, Bianca's going away now.
I'm going away. I'm going to dissolve into the black pupil of my eye and become the pupil, and then fall into the black hole and become one with the universe and become a star in the sky. So
but that felt like
real,
sad and scary, but also true, and like just matter of fact.
It felt so true.
Yeah.
It was so scary. I don't know if I was sad about it, but it was just scary because I was losing sense of everything that I was attached to as a human. And the person that I was with said one thing that snapped me right out of it, which was, so what? It was, so what? And then I was like, oh yeah. No, yeah, so what? No, yeah, I'm fine. Okay, I'm fine now.
So what bounced you back into being a human being?
That bounced me right back. This is so, I mean, I don't know if anyone's going to understand what we're even talking about, but that's how psychedelics is. It doesn't really make sense.
Yeah.
And psychedelic therapy, like dream work, is making sense of something that doesn't necessarily tangibly make sense in the way that we are used to.
But isn't there kind of a therapeutic lesson in that? Because I think a lot of where human beings get tore up is in trying to assign value or responsibility or culpability for any number of things that occur in our lives, which really we have no business trying to.
Exactly.
Yeah.
Like you get in touch with the mystery of life, and there's a sense of surrender. All of the ego death trips, or the difficult trips, the scary trips that I've had, have probably been the most profound experiences. The growth after each experience, the shift that happened, the understanding of the nature of the world and nature of, existence and the mystery. Yeah, that is powerful. Yeah.
Lightning round, which is more probably like a slow firefly. I wanted to talk about your Korean heritage. How has your Korean heritage informed your view of maybe psychology, or just the dynamic between patient and caregiver, provider? Like, are there ways in which being Korean American have informed like your practice or your spirituality or your belief in what humans can do for one another?
Yeah, definitely.
Anything you can like sum up easily, like?
Okay, I'll try.
Yeah.
So there's a word in Korean called chung. There's no word for it in English, but I like kind of want to get my phone to find if there's an English word for it, but it
can be homework.
It's a homework. It's like a warmth about between humans, so that connects us.
Oh, that's cool.
Yeah, and I'm probably butchering.
How do you spell it? We'll put our man behind the board to work if we may. We're well equipped here.
Yeah, it's like Jung.
Oh, Jung. Okay.
I mean, I don't know. There's no direct translation.
But it's a Korean word.
It's a Korean word.
And to the best of your knowledge, it means warmth between humans?
Yes.
Do we have any official returns?
That's it. A deep, warm feeling of attachment, connection, and shared bond between people, places, or even things.
A deep, warm feeling of attachment or connection between people, places, and things. Yeah, the force.
Yeah, kind of like that. So it's like that connectivity.
Uh-huh.
It's sad that we don't have a word for it in English, but it's part of the Korean culture. And it's this deep sense of humanity that, there's so much about the Korean culture that is beautiful, and there's also so much of it that, has so much trauma. And I think the trauma piece of it also has made me who I am, and made me understand more about trauma and post-traumatic growth and the importance of mental health. Actually, Korea is with Japan competing to be like the #1 highest suicide rate in the world, with Korea being such a small country. And so, not only until recently has mental health been acceptable in Korea. So even now, there's a lot of stigma behind mental health treatment. So
in South Korea.
In South Korea. I mean, I'm sure North Korea is worse.
Yeah, but when we talk about Korea, are we generally talking about South Korea?
I'm talking about South Korea because I don't really know. I mean, I live in North Korea.
Korea seems like it would be a more suicidal place, but to put it like very crassly.
Yeah.
But South Korea has a problem with suicide rates. And any particular demographic?
teenagers, celebrities.
Yeah. The beauty standard in Korea is pretty overwhelming, right?
The beauty standard in Korea is very overwhelming. Not only that, all standard. Just there's high expectations
for behavior and for protocol and for obligation and decorum and Wow.
So, and I was living there. I went to university there, and I was living there until my mid-20s, until I came back and had my spiritual awakening. So a lot of that also has to do with some of the trauma that I experienced in Korea and some of the cultural boxing in that I experienced over there. Which actually, I'm going to go off tangent here. I'm creating this series for Asian Americans, healing, workshop for Asian Americans, based on everything that we're talking about right now. So the burdens that we feel, the cultural expectations, the shame and guilt culture is very, very strong.
All the guilt for not having completed your piano teaching up till the age of
everything, right?
Yeah.
The kids are at after school programs until 10 p.m. and they're 10 years old. And then they have to go to school at 8 a.m. And then again, English, sports, music, math, science, whatever. It's just, it's you have to be the best at everything. And it's a really cutthroat culture where they promote a lot of competition. And there's a lot of pain there in that culture.
Mm-hmm. And epigenetically, potentially, for you, if that makes any sense, right? From your family, you were born in Korea?
No, I wasn't.
You were born in the U.S.?
I was born in the U.S.,
Okay.
but I grew up with my Korean side of my family. So I grew up with my mom and my grandparents.
And they carry all that with them.
They carry all the old school Korean stuff. Yeah. So actually a lot of the second generation Koreans, Korean Americans will say that they were raised with more traditionally Korean expectations than the Koreans our age in Korea, because they've adjusted to modern culture. But still there's, still the pressure's so strong there. So it's a really stressful environment. There's a lot of goodness to it too. I don't want to say all bad.
Yeah, we were
things.
started with Jong, and then we went into the warmth between people.
Yeah.
But, calling back to that, that's a part of you.
It's a part of me.
Yeah.
Yeah. All the good and the bad.
Yeah.
Yeah.
And before we conclude, I wanted to give you a chance to talk about a part of you now that is a good part of you. Seems like a part of you that you're very excited about, and that is a immediate and healthful part of you, and that's ecstatic dance.
I love it.
Yeah.
Yeah.
So I think a lot of people can sort of have in their mind's eye a picture of what ecstatic dance might entail. I think maybe ecstatic dance looks different in California than it does maybe in Ohio. I don't know, but maybe people are ecstatic dancing the same way everywhere. And you probably feel like ecstatic dance should be done more and understood more broadly. Do you?
You're putting words in my mouth. No, yes, I do.
It's taking a guess.
It's everyone should be doing it.
Yeah.
Ecstatic dance, there's no way that it should look. It's free-form movement. It's about being in your body, letting go of your mind, letting go of the patterns. Because now we know trauma lives in the body, right? The body keeps the score. Everybody knows that book, on trauma. The body holds on to our tensions, our traumas, our stresses. The body is a map. Your body is your individual map of what you've been through, everything that you've experienced. And there's certain ways that we hold our face. Some people tense up their eyebrows. For me, I tense up my shoulders all the time, and I always have to, okay, let it go. Let go.
What about TMJ? What about clenching your teeth?
I get that too.
Is that a body keeping the score sort of scenario?
Yes,
Yeah.
it is.
Yeah.
Yeah, everything is.
So there's a way to...
Yeah, so ecstatic dance kind of frees that up, and it's also another way to get to an altered state of consciousness. That's what it was originally used for back in the day, in the indigenous tribes, dancing around the fire, in Africa, in the Americas, in Asia too. We have shaman culture. In all of these, it was a ritual. Ancient ritual of rhythmic dance. You know, they did it to drumming, they did it to, you know, whatever. There was this like rhythmic motion to it, and the current ecstatic dance, yeah, there's like some rhythmic, like trance, like, you know, drum type of music that goes into a playlist, but also it's more about you know, breaking through that stage of, usually when you're going into an ecstatic dance for the first time, or even the first couple times, or even if you've gone for a lot of times, sometimes you go into a new environment and you see new people and you kind of get in your head, worry about, what are people going to think about me? Like, what am I going to look like?
There's so much shaming around dance.
Yeah.
The fact that it's even part of our lexicon that someone says, they can't dance. You can't dance.
Yeah.
Oh, he can't dance.
Yeah.
Yeah, like, what? Like,
Yeah,
come
what are you
on.
talking
It's
about?
such not
Yeah.
a fair thing to say.
It's so unfair. Yeah, it's more so freeform movement. You know?
Rhythm is probably different than dance,
you don't
right?
even need rhythm.
Yeah.
Who cares about that? And always, like, my saying when I'm teaching my workshops, I'm always like, get weird. Be freaking weird. Look weird. Do not worry about what you look like. Connect with what you feel like. Let your body do the moving, you know, get out of your head. And initially there's this portion where we are in our head space and we are thinking in our head. So I start with breath work and a little bit of stretching and some guidance onto how to you know, I give a little guidance, like, let's maybe roll the shoulders. You know, everything is suggestive. Okay, now how would you move your arms in a circular motion? Maybe imagine that you're a tree and there's a hurricane and your leaves are blowing. And then kind of like guiding towards getting out of your head. Right? Okay, be water. Be some form of water and move around the room. Maybe you're a lake. Maybe you're the ocean. Maybe
play.
you're a river. It's play. It's
Yeah.
all about play. And when you move despite being in your head, you know, we're going to be in our head. There's a part of the dance or the movement that you kind of break free of the thought. And that's when the ecstasy or the altered state happens, is when you continue to move your body despite your mind, and then at a certain point your body takes over. And that's really the philosophy behind ecstatic dance.
Oh, that's what differentiates ecstatic dance from other forms of just horseplay and dance and goofing around.
Yeah.
Like getting to a point where the body kind of takes over. With the help of somebody like yourself who's saying, be water, be a feather.
It doesn't even have to be like the help of somebody. You can just turn on some music and it can be with the help of the music. Or you can just start moving your body, and the body is wise. There's the body keeps us alive without us thinking about it. So all you need is your body and your breath. And music helps, and guidance helps, and being in an environment where other people are embodied in freeform movement and not worrying about what they look like, and you feel that sense of non-judgment in that space. That's really powerful too. That's why I love groups, because when you're in that group, you're having a shared experience. And in the ecstatic dance groups, you're in this group where everybody is open to being weird and letting go of judgment towards others and towards themselves.
I love to go see the jazz concerts at the LA County Museum of Art. from K-Jazz. They're one of the sponsors of these shows. And to the side of the stage, there's always a groovy California character who's dancing ecstatically every time he's there. He's like a fixture. And it's fun for me to see. And part of me, that part of me, inside part, is a little bit judgmental, of them doing, oh, what a weirdo, they're doing their thing again. But more of me knows that good for them, and that they're getting in that space, and the movements, they look eccentric, they look unhinged, they're not coordinated necessarily, but that person is like having an experience, and they're able to that the live performance is such a beautiful thing, and that atmosphere is kind of feeling that. And part of me always wants to just like rush off and join in too, but I'm still very inhibited. Like, I can't just run over there and start ecstatic dancing with this person because it feels like a social taboo.
Right.
Yeah.
Maybe if there was 10 people doing it or 20 people doing it, you'd feel more comfortable to jump in.
When you show up to do it and everybody knows that's what's going down, that's a different experience, right?
Yeah. And another thing with ecstatic dance is when you get to that state where the body starts to take over and you experience an altered state of consciousness, healing happens, and we have a lot of somatic releases which look like crying or laughing or burping or fart, anything. It could be like any sort of somatic, sneezing, coughing. Like I had a workshop on Sunday, and we had 3 or 4 people who were able to really release and get into this like deep state of like releasing grief, and they were crying, and one person crying, and she was really letting it out, and I was encouraging just to let it out, and then it kind of helped give permission for the next person who was dealing with some sort of grief or loss or something in her journey to cry, and then it kind of triggered another response in someone, and it was really beautiful. And that's it's also a journey, right? Just like the psychedelic journey, the ecstatic dance is also when you can get into it, it's this beautiful healing journey, and people have these experiences, and they go through an actual journey. Like this other 2 girls in the group just this Sunday, they said that their past wounded child and then their ideal future self merged and then came into them, and they felt like they came home to themselves in that workshop. So
that's cool.
It's cool. Yeah.
I'm glad you found it, and I'm glad you're helping others find it too.
Yeah.
You might have just said this, but I want to be respectful of your time and the audience's time, obviously, but look into the camera and tell our audience something mind-bending.
Oh my God.
I'm putting you on the spot. And
Wait,
just
this was not in the script.
No, this is
you didn't
improvised.
ask me to prepare for
so
this.
what's something mind-bending that our audience should that you want them to know?
Wait, okay, give me a moment. Mind-bending that I want them to know?
Yeah, what's something that you find to be mind-bending? It doesn't even have to be about anything that we talked about today.
Something that I find mind-bending?
Yeah. And tell that person that needs to hear it today.
Okay, let me see. What message should I channel? Mind-bending. Your reality can change in an instant. Healing can happen in an instant, even if you've been dealing with stuckness or pain or suffering for a really long time. So,
my mind is bended.
Did I bend your mind?
I think that was a perfectly appropriate first time.
For my first time.
Yeah, and that's something that I think. I appreciate you going on a limb and sharing that. And I appreciate you going through everything that we covered today. And I hope that you feel like we covered enough of what's currently happening in your world.
Yeah.
Yeah?
Yeah.
How do people find you and learn more about the work you're doing?
herpsyche.com. Also my Instagram that I'm working on, herpsyche. Those are the best places to find me.
Awesome.
For now.
Cool. Bianca, thank you so much for joining me on the show today.
Thank you.